رح نعمل round a case scenario. 7-year-old child complains of cough. أنا بدي أعملكم كلكم unmute عشان تشاركوا معي. okay? اوكي ايش بتحبوا تسألوا عن طفل عمره 7 سنين is complaining of cough?
duration
2 days. اوكي مين بيحب كمان يشارك؟
productive أو لا
اوكي الأم وصفت الكف إنها was wet.
with blood
no hemoptysis.
السبيوتم إنه شو لونه يعني ممكن
was not able to expectorate sputum.
continuous
not productive.
continuous or intermittent
continuous. سامعيني كويس؟ طيب اوكي ايش كمان؟
exacerbating at night or at the morning
no diurnal variation. No diurnal variation. okay.
الكاركترستيك للكف
It was wet. What do you mean by characteristic?
violent, for example, like moving cough, something like
no special character. okay شو كمان؟ شو تحبوا؟
association to food.
no association to food. what else?
Aggravating factor.
No triggering factor or exacerbating factor. Sorry.
إنه هل بسبب عندي مثلا إنه vomiting أو يعني
okay.
ممكن إنه نعرف severity منه يعني.
followed by vomiting. what else?
نسأل do you hear any sound like wheezing or strident like that?
no abnormal sound. what else?
Nasal discharge.
yes there was rhinorrhea.
fever أو لا؟
yes there was fever. 39 axillary.
إذا عندي chest pain
there was chest pain.
Shortness of breath.
yes there was shortness of breath. okay what else?
Physical activity.
بس 38 عددكم قليل بحكي. okay what else?
feeding
there was no feeding issues.
Activity, loss of activity.
yes there was limitation in activity.
does it have any skin rash or eczema?
no skin rash. what else?
and do not sweat?
no night sweats. no night sweating. okay anything else?
This is the first time or recurrent يعني فيه
yes it's for the first time. complaining of cough 2 days ago. First attack. No previous similar attacks. Huh?
في dysphagia أو إشي.
Dysphagia? No, dysphagia. Why did you ask about dysphagia?
Maybe for tonsillitis.
Okay, good. What else? If you want to type your participation, I don't have a problem. Okay. Let me summarize. We got a 7-year-old child, previously healthy, complaining of cough that 2 days ago associated with fever, 39, high grade. The fever was documented, was taken or measured axillary. The cough was wet, not productive. No special characteristic for the cough. No diurnal variation, described as being wet. It was persistent or continuous, followed by vomiting. No change by time or no diurnal variation, no exacerbating or relieving factors. There was chest pain and difficulty in breathing. Do you want to know something else?
If there's any pets in the house.
Why did you ask about pets?
To rule out allergic related causes.
Okay. Do you think that this is allergy?
Maybe a
Anyway,
new
we'll come
onset
into
one.
that, but there are no pets. What's that? Sorry. Yeah. What
Maybe
else? What would you like to ask about the chest pain?
إنه with breathing يعني إنه increasing with increase with breathing إنه pleuritic يعني chest pain.
Okay. Yeah. When does the pleuritic chest pain happen?
Pneumonia.
Okay. Increases with breathing. What else would you like to ask about the pain?
Side?
Yes, right side. Okay, what else?
ممكن إنه إذا في neck pain أو abdomen pain لأنه ممكن يصير pleuritic irritation ويصير في زي radiation أو هيك.
No, it was not radiating.
Association with cough.
Yes, it was increasing with breathing and cough.
Localized ولا poorly diffused.
It's mainly on the right side. It's not pointed to a small area. Actually, over the right side, the whole right side.
Onset of the pain, يعني sudden or gradual?
Yeah, started with the fever. Okay, given this presentation, what would you like to examine? نيجي على physical examination.
أول شيء general look eloqual or
Patient looked ill. Okay, what else?
الchest wall هل يعني في مثلا inwarding أو
respiratory distress syndrome أو يعني بشوف الساين لإلهم.
What are they? Can you tell me?
مثلا
using of
subcostal
accessory muscle.
intercostal retraction مثلا use accessory muscle.
Yes, the patient was retracting.
Nasal flaring.
There wasn't flaring. No flaring.
Vitals, respiratory rate والpulse.
Yes. طيب. أعطيكم respiratory rate. مش عارفة ليه مو راضي. respiratory rate رح أعطيكم رقم 40. What do you think about this number? Respiratory rate of 40 in a 7-year-old child. Is this
rapid respiratory.
Yes, this is tachypnea. What's the upper limit for his age?
30.
20.
Yes,
30.
above 20, actually, above 20. Okay, what else? The pulse is 160. Temperature, it was 40.
مش قلنا 39
هذيك بالهيستوري يعني قاسوها بالبيت كان 39. هلا بالفيزيكال اكزام اما قسناها احنا كانت 40 orally. blood pressure 90/50. What else?
بدي أشوف على البيركشن إذا في دلنس أو
يعني خلينا بالجنرال لسه احنا يعني ما رحنا على الchest. Pause the chest but still we are looking at the patient. What important things other than the vital signs in a child of cough and chest pain?
ممكن نفودينوباثي.
What's that?
cyanosis
Yes, patient was cyanosed. He had blue lips. What else? It's very important to ask about the oxygen saturation or measure the oxygen saturation. It was 78% at room air. What do you think about this number?
decrease كتير يعني هو
Hypoxia.
لازم يكون 90 يعني.
Yes, this is hypoxia. Patient is hypoxic. What's the normal oxygen saturation?
90 and above.
more than 90
94%. Below 94, this is hypoxia. I should apply oxygen. Okay? Okay, good. What else?
tonsil hypertrophy.
Yeah, we need to examine the throat. Was normal. What else?
Mental status.
What's that? Mental status.
Mental state.
Patient was easily arousable. Yeah, but he was in pain, sorry. He was in pain, looked ill, in pain.
Chest
What else?
expansion.
What was that?
Chest expansion.
يا هلا بنروح للchest بس كملنا general ولا بدكم تسألوا إشي تاني؟ Where do we look for cyanosis? We looked at the lips, they were blue. Where should we look also?
Under the tongue?
hands
Peripherally in the hand.
Hands,
Cavities.
yes. Look for peripheral cyanosis. So he had blue hands too. He had blue lips and hands or fingers. طيب هلا نروح للchest. ايش بدكم تشوفوا؟
نبلش inspection.
The tissue deformity مثلا أو شيء.
Yeah, he was retracting as we said. There wasn't any deformity. Okay.
Symmetrical.
If it's moved with respiration?
Limited movement. The respiration. What else?
Use of accessory muscles.
He wasn't using accessory muscles. No use of accessory muscles. Okay, what else? Yalla, be quick. Wanna go for palpation? Yeah, we should also look for scars, abnormal chest shape, but he didn't have any. The only thing that we observed is the presence of retractions, as we mentioned in the general part, and that he was tachypneic. Please don't forget to count the respiratory rate for any child complaining of a respiratory complaint. Actually, it's one of the vital signs, but don't miss counter a patient complains of cough or difficulty breathing. And don't forget the oxygen saturation, because it's the fifth vital sign. It's very important not to miss the patient being hypoxic, okay? What do we do during palpation?
If there's any tenderness,
There was tenderness on the right side. What else?
Tactile vocal frematus.
Tactile vocal frematus. How do we do it?
44 حط ايدنا على صدره. كمان posterior chest وanterior chest يعني على الجهتين.
Was increased over the right side. We should compare it, right? Yeah, between both sides. What else?
chest expansion.
سؤال
تفضلي.
كيف يعني شلون نحكي للمريض إنه أحكي 44 وهو مثلا لسه صغير إذا كان عمر أصغر؟
Yeah, 7 years, he can follow your instructions, but 5 years, no, they cannot do that. So you should skip it. Okay?
Yes.
Yeah. Okay, what else? Subcutaneous emphysema. How do we do that? How do I assess for subcutaneous emphysema?
General palpation.
Yeah, okay. No subcutaneous emphysema. What else?
Tracheal deviation, if it is important to you.
Tracheal deviation.
Chest expansion.
Yeah, we said that. Limited chest expansion.
Cricotracheal distance.
It was normal. طلعت شغلة واحدة بس مهمة. What about the apex beat? Right? What's the importance of assessing the site of the apex beat?
ممكن بتكون مفلج.
Hyperinflation. If there is hyperinflation, it will be muffled.
Okay, so come on.
If it's displaced, maybe pneumothorax on the
Yeah, good. So if there is a pneumothorax on the right side, the apex beat would be shifted to which side? I mean, if it's shifted to the more to laterally, where do you expect the pathology to be? Pneumothorax.
On the right side.
On the right. Oh.
Yeah. Type. Okay, good. It was in the fifth intercostal space, or let's say fourth, and it was in the mid-clavicular line.
Normal.
Okay, yes. Then what's next?
Percussion.
Percussion. There's a dullness on the right side. Then what? Auscultation. What do we comment on when we auscultate?
Symmetric.
airway entry symmetrical أو decrease أو increase bronchial breathing or مثلا حسن.
We should comment on the type of breathing, whether it's bronchial or vesicular. We should comment on the air entry. He had decrease in air entry on the right side.
added sounds مثلا.
There were crackles on the right side. So what do you think were differential diagnosis?
Pneumonia.
Where?
The right side.
Right side.
Yes, good. Why did you say pneumonia?
Increase total vocal vacuole bronchitis ممكن. هي الوحيدة اللي بيزيد فيها pneumonia.
Okay, very good. So the tactile vocal phragmitis increase on the right side. What else? Other clues that this is possibly pneumonia.
Bronchial breathing.
Bronchial breathing.
Bronchial
crackles.
breathing. Yeah,
Limited
yes,
chest
good.
expansion.
Crackles, limited chest expansion. What about the history?
Yes.
Hypoxia.
Fever he had.
Fever.
Sign of upper
else?
respiratory.
Chest pain. Tachypnea.
Thoracic chest pain. Yes, good. Yes, okay. Type. What do you want to do for this patient? Management. Management includes also interventions or diagnostic orders.
I want to order X-ray.
طيب لو سألتكم عن أول شيء بتعملوه لهذا المريض قبل ما تطلبوا
Oxygen.
Oxygen saturation.
No.
Yes, very good. Oxygen is number one. How would I apply oxygen? Either via nasal cannula. Have you seen a nasal cannula? Or mask? عمركم شفتوا nasal cannula?
Yes.
Yeah.
Okay, what else? Nan?
Chest X-ray.
Chest X-ray. Good. What else?
Doctor,
Maybe
shouldn't
blood
we
culture.
stable the patient?
I think the patient is not stable. In which term you mean?
يعني low blood pressure وhigh pulse.
Okay, blood
Well,
pressure.
it's not considered to be very low.
Yeah, is this normal for his age? This is important. Is this normal? Yes, it is normal. How would I know the normal blood pressure for certain age? We have charts for blood pressure. Do you know that charts are available for children to know the 50th percentile, 90th and 95th percentile?
دكتورة بس هو 7 سنين يعني مش المفروض يكون أقرب للأدلتس يعني.
No, still, he's not in the adult range. Above 12 years, they will reach the adult range, but this is normal. Okay?
Okay.
Yeah. طيب زميلكم حكى إنه we need to stabilize the patient. Now, when you apply oxygen, I want to give you the reading. صار 98%. Which is good. يعني ممكن هذا المريض ما يتحسن على أكسجين لحاله. ممكن يحتاج intubation. But when I apply oxygen, I should make sure that the oxygenation got improved. I can give you the reading that it became 98%, which is normal, right? Okay, chest X-ray. I will give you the chest X-ray image now, but what else you want to order?
Arterial blood gases, maybe.
Blood gas, good.
Culture. Blood culture.
Blood culture.
Blood culture. Huh?
CBC with the blood culture.
What else? شيء ثاني؟ طيب.
Newton culture.
The chest X-ray. This is the chest X-ray. What do you see here?
Right
upper lobe consolidation.
Consideration.
Yes, very good. So this is opacity in the right upper lobe, consistent with pneumonia, right? Okay, regarding the ABG, the PO2 on oxygen was 150. The PCO2 was 35. What do you think about the PCO2?
Decreased.
Yes, it was 7.35. This is, we consider this as the lower limit of normal. Okay, so I would be concerned about increase in the CO2. Increase in the CO2 means respiratory acidosis. Okay? Yeah,
Increased?
If the CO2 is increased above 45, this is considered respiratory acidosis and failure. Our meeting will end in 10 minutes. One at 5:30, okay? So we can continue. Hemoglobin was 13. What do you think?
Normal.
Normal. The white BC were 18,000.
Elevated.
This is leukocytosis. Okay. The platelet were
upper limit.
Yeah, on the upper limit of normal. Okay, what else do you need in the CBC?
شوفي يزنفل كمان إذا كان في allergy. يزنفل.
Are you concerned about allergies?
No, it's just يعني إحنا عاملينه.
طيب. Yeah, of course we will look at the eosinophils. They were 2%. Regarding treatment, what I'm going to do here. سؤال هلا, are we going to admit or not?
Yes, we admit the patient.
Yes. Depending on curve 95 ولا؟
لا, ليه قررنا هذا المريض؟ ما بقدر أوديه على البيت.
Saturation كان low.
Yes, he's hypoxic. He's tachypnic. He had cyanosis. He was retracting. I cannot send the patient home. He had decreased activity and pain. He cannot be managed at home. He was not well looking. So there are several reasons that mandated the admission of this patient. Good. What's the treatment?
Hydration.
What's that?
Hydration.
Hydration.
Empirical antibiotic.
Cephalosporin, third generation cephalosporin.
It's very
حد
good.
ما يطلع الكلشر.
Antibiotic
as third generation cephalosporin. Do you know an example?
Ceftazidime.
Ceftriaxone.
Ceftriaxone, sorry, أو cefotaxime.
Ceftriaxone. Did you get the antibiotic lecture or any discussion about it?
Not yet. لا.
هدول famous third generation cephalosporins that we use, ceftriaxone or cefotaxime. This is considered the empirical treatment of lobar pneumonia, to give third generation cephalosporin, or you have the option of giving second generation cephalosporin, cefuroxime. So why was this our choice for treatment?
Streptococcus pneumonia.
Yes, very good. So the most common organisms causing pneumonia are strep pneumo, or streptococcus pneumonia, sorry. What else do you know?
هيموفيليا انفلونزا
اتش انفلونزا.
H influenza,
بروكزيلا تيتراليز
Streptococcus.
Marexella, Iteralis. What else? ضلت وحدة. هدول كتير مهم تعرفوهم، okay?
Group B Streptococcus.
Aureus.
ستاف
ستاف
اوريوس.
اوريوس
Yes. Staph aureus. هدول المين bacteria. Is Streptococcus pneumonia considered in our vaccination program?
نو
Yes.
بس
No.
موجود الفاكسين بس مش موجود بالمطعم الوطني.
We give them
Yes, very
for
good.
elderly patients above 65 years.
Yeah, okay. So it's not part of the Jordanian national program. It has been approved actually to be implemented, but they didn't start it yet. Okay. The scheduling for Streptococcus pneumonia vaccination should be at 2, 4, 6, and 18 months. So children should get 4 doses at 2 months of age, 4 months, 6 months, 18 months. Okay. And it's given in the conjugated form, conjugated streptococcal vaccine.
دكتور ممكن تعيديهم بالله؟
2, 4, 6, and 18 months. It's given in the Western countries والGulf countries, بس بالأردن زي ما قلت لكم, still it's not available. In the market, the parents may buy it. يعني it's available in our market, but it's not for free. They need to pay for it. Okay. طبعا Streptococcus pneumonia is something important to protect the child from because it can cause pneumonia, it can cause otitis media, sinusitis, osteoarthritis, meningitis, and bacteremia. It can cause several diseases, invasive diseases, and serious diseases, like meningitis. So it's worth vaccinating the child against Streptococcus pneumonia. طيب هلا بالwestern countries the first line to treat when you get low-burn pneumonia is ampicillin because their children population is vaccinated against strep pneumo. Here we are not vaccinated. The resistance is higher against ampicillin, so it won't be our choice. Our choice, as you said, second or third generation cephalosporins. طيب قد ايه بعطي المريض انتيبايوتيك؟ خليني
2
اعطيكم.
to 4 weeks.
We
7
start-
على 14 يوم.
Good, yeah. At least 7 days, 7 to 8, okay? In cases of simple pneumonia. This is simple low-burn pneumonia. It's not complicated. طيب هلا لما بدي اخليه بالمستشفى خليته اول إشي بعد يومين اعطيكم البروجريشن. بلشنا الانتيبايوتيك، بعد يومين صار افبرايل، راحت الفيفر، الاكسجينيشن تحسن، صار 97% at room air. عدت السي بي سي الوايت سيل كاونت نزل من 18,000 ل 12,000. He started to look better. He started to eat. The pain had resolved. So do I need to keep the patient in the hospital for
No, we send him home يعني.
or we can discharge the patient? Yes, we can discharge the patient when the clinical condition improves. And you can continue the course of treatment as an oral course, okay? You have several options. Either you give high dose amoxicillin or amoxicillin clavulanic acid, or we call it amoxiclav. You may give second generation cephalosporin, اللي هو ceftriaxone. It's available in both forms, IV and oral. Okay, you can give cefdinir. Well, again, another second generation cephalosporin. Good. We are done with the first case. حدا عنده سؤال؟ حدا بحب يسأل إشي؟
أنا دكتورة.
تفضلي.
دكتورة لو سمحتي CO2 نورمال بريشر عند الطفل قد إيه؟ يعني الرينج
ما بيختلف عن الكبار، هو consistent، يعني أقل، هو تقريبا من 40 ل 45، يعني 35 حتى أحيانا الريفرنسز ممكن تحطها من 35 ل 45 but this is considered the lower limit of
إنه لو
normal above 45.
أوكي تمام
أوكي،
خلاص أوكي
حدا عنده
شكرا.
سؤال؟
دكتورة ما نشك إنه he might aspirated something يعني.
Okay, you may ask about it, but it's unlikely بهذا السيناريو. You may think of it يعني choking event. You should ask about any choking event. All choking events won't be missed بهذا الage. طفل عمره 7 سنين unlikely إنه هو ما يميز إنه تشردق أو أهله لاحظوا عليه. يعني ممكن choking events to be missed بطفل عمره 2 أو 3 ما يكونوا الأهل انتبهوا له أما بلع شغلة، أو هو ما يعني صعب إنه طفل عمره 3 سنين